Hey, good afternoon. My name is Dre Johnson, air personality here at 92Q. You can catch me Monday through Fridays inside the morning hustle. You get the breakfast bite. And of course, on WBAL TV on Fridays, the breakfast bite, and Saturdays, 2 to 6. And today we're talking about some very important stuff today concerning healthcare, especially with COVID-19 going on. Healthcare is more important than ever. And joining us this afternoon is Paris Bonds. She's actually the community liaison over at Healthcare Access. Correct, Paris?
Right. How you doing? Good to see you again.
No doubt. Good afternoon. So the purpose today, we're going to be talking about affordable healthcare and its open enrollment for 2021, correct?
That's right.
All right. So healthcare, like I said, is very, very important, especially during this pandemic. Um, can you tell us how does the Maryland Health Connection works?
Of course. So the Maryland Health Connection is the state's official marketplace for health insurance. So it is the only place where you can apply, shop, and view for plans and be offered financial help paying for the cost of your plan. All you have to do is go to www.marylandhealthconnection.gov and apply online.
Okay. And okay. So you just told us how people can enroll. Is it easy to enroll?
Very easy to enroll. And if you ever get caught or hung up in an area, there are experts like myself who can walk you through the application process. Although we're not in the office to help you in person, which we surely miss you, we are home ready and prepared to help you over the phone or through a video chat, whatever method works for you.
Okay. And what types of plans are available? And with COVID-19 happening, does this involve testing?
Yes. So Maryland Health Connection offers health insurance through Care First as well as Kaiser. And this year, we are very happy to welcome back United Healthcare. So now Marylanders have more options than ever to be able to purchase plans. And all plans purchased through the Maryland Health Connection will cover testing as well as any treatment as a result of COVID-19. So people can have peace of mind, understanding that they'll be taken care of.
Okay. And I was looking at some facts. As of 2016, there were 360,000 Marylanders who did not have health insurance, but 120,000 of them are eligible for health insurance. What can they do?
So that's a very sad and startling statistic, but the truth is everyone should be applying. 9 out of 10 people who apply get financial help to reduce the cost of their plan. So the first step is to apply, and then we can help you out with figuring everything else out from there on. But people should be applying and trying to take advantage of the health coverage they deserve.
Okay, is this a part of the Obamacare?
Yes. So Maryland Health Connection is a direct division of the Affordable Care Act, or Obamacare, as we endearingly call it. Yes.
Okay, so like you said, the healthcare plans are affordable. Is financial assistance available?
Yes. So again, 9 out of 10 people get financial assistance, help reducing the cost of that plan. And the Maryland Health Connection is the only place in Maryland where you can shop to get that financial assistance. So it's definitely to any consumer's advantage to just take a look and see how it works for you. We can plan shop, we can compare. You can even go online and get an estimate to determine which plan works for you based on how often you go to the doctor.
Okay. Okay. Can you explain to us the HMO, PPO? Are they available in this plan?
Yes. So HMOs and PPOs are available with each carrier. Some carriers function strictly as a HMO, and then some of them have the option for both. But consumers have the option of choosing whatever works for them.
Okay. And so what's the difference in this plan and Medicaid?
Ooh, that's a good question. Okay. So private health plans through Maryland Health Connection are plans that you're going to purchase through your commercial carriers, such as
Okay.
Care First or Kaiser or United Healthcare. Maryland State Medicaid is an income-based program that offers consumers free or low-cost health coverage based on their income and household size. The good thing about the system is smart enough to determine which one you're eligible for during the time of the application, and you'll have a result right at the end.
Okay. And if you have any questions, for Paris, please, hit us. We are here. What do people need in order to enroll?
Sure, people need an ID. They need social security numbers for individuals in their household. Any immigration documents, but only for the individuals applying. So if you're not applying for coverage, we do not need that information. Income information such as pay stubs or tax returns, and then any policy information about current insurance you may have. The reason we do that is because it assists us with comparing your plan and determining the best cost for you.
Okay, and again, we're talking to Paris Bonds from the Health Connection.
Yep,
And so,
Maryland.
how can people enroll, and what is available once they enroll?
That's a great question. So people can enroll online by reaching out to marylandhealthconnection.gov. They can apply the Enroll MHP app, or they can contact a navigator like myself throughout the state that'd be more than happy to assist them with enrolling over the phone or through a virtual meeting. And that phone number is 410-500-4710.
Can you repeat that again?
Sure. The phone number is 410-500-4710.
Okay. So Paris, health insurance is important. Very, very important. What would you say to the people that just with the enrollment, it might be just confusing to them? What would you say to them?
I would say to them that I completely understand that the enrollment process can be confusing and it can be daunting to someone who's doing it for the first time. But that is why people like me exist, to take that burden off of you. Let us help you out. We are trained experts in this, and we can definitely give you peace of mind. Let us do it for you. We'll do the hard work. We'll get the documents from you. We'll do the whole application start to finish, and we will hold your hand throughout the entire year with assisting you with using your health insurance. Whatever questions you have, we're here to help you.
Okay, and so we know, Paris, COVID-19 is affecting people physically as well as mentally. How does this plan fit into mental health?
So all plans offered through Maryland Health Connection are going to give you those ambulatory services, physician's visits, as well as those mental health and behavioral health visits. So all health insurance carriers are going to cover this service for you. So no matter what plan you get, you are entitled to this benefit, and you can utilize the benefit how you see fit.
Okay, and does it cover dental also?
So we do have dental plans for purchase on the website, so we can help you shop for health and dental. Yes.
Okay. Healthcare, health coverage this year, so very, very important. Could you just break it down? Why is healthcare so important this year with everything that's going on?
Healthcare has been important, but it's more important now than ever because our economy and our government and our state in general is facing a horrible pandemic. And people need to honestly take it seriously that having health insurance is what's going to offer you that peace of mind. Of course, everyone won't test positive for COVID, and of course, everyone won't get the flu, but having that insurance policy is your blanket. If something does happen, you really want to be covered to know that everything's going to be okay if something happens. I can get my testing, I can get my medication, I can get that quality coverage that I deserve. So it's really important to understand that you deserve this health insurance. This is for you. You deserve it. It's not like we're giving you something you should not have. This is something that you deserve for your own peace of mind and for your own physical and mental well-being. It's for you.
Okay. And again, if you have any questions for Paris, hit us up on Facebook and Twitter. And short term, I seen something about short term healthcare. How does that work? And does that work in this plan?
So short-term healthcare isn't necessarily something that we sell. However, individuals have the opportunity to, if they wish to opt to change to go to a different insurance, so if they get employed and they want to cancel this coverage and go with their employer coverage, they can do that. Or if their income changes and they no longer can afford that qualified health plan that they used to have, they can come back to the application process and we can look and see what we can do to reduce the cost. So it's not necessarily short-term plan. What we want to think about is this plan is almost like, it's not a one-size-fits-all plan. This plan is going to be able to adapt to whatever happens in your life.
Okay, and the number again?
Sure, that phone number again is 410-500-4710.
Okay, and this is the Maryland Health Connection, correct?
That is the phone number to Healthcare Access Maryland. That's going to get you to a certified navigator like myself who's going to be able to get in there and do that application for you today.
Okay. And I have a question. For you from one of our listeners. What about people that have a business but don't work for a company? What do they need to know about your services?
They need to know that they should be applying too. So if you have a small business and maybe not necessarily a company, we're still going to apply for you the same way that we've applied for anybody else. We still look at the income, which you have, your household size, your needs, and we're still going to apply for you the same way. So the coverage that you get should match what you're able to afford to pay. So we're going to treat you just like any other consumer, and we'll go ahead and assist you with applying.
Okay, and so is that monthly payments?
Yes. So your insurance premium should be paid monthly, typically the first of the month. But yes, it is a monthly payment.
So it's basically like maybe like life insurance. Like you
It
pay
would
a
be
life
like life
insurance premium?
insurance because it's not going to cover you in the event that something should happen to you after you've transitioned. But this is more so if you get sick and need to see a doctor, or if you need to seek treatment for a pre-existing condition, or if you need to seek treatment for a new condition. So this wouldn't necessarily cover you after life, but this is something that's going to take care of you right now to help you live the longest life possible.
Okay. Are any of these plans free?
So Maryland State Medicaid is a free or low-cost product. So that would be the product that we would consider possibly being free. There are some individuals who do pay a small amount for Medicaid for children, but the application process is simple enough that we'd be able to tell you what you get on the spot.
Okay. Another question. So even if a person lost their job recently, how can they get health insurance?
They should be applying. So if you lose your job, you have something called a special enrollment period. You have 60 days from the date that that life event happened. So 60 days from the date you lost your job to apply for health coverage. At that point, we would apply for you using what your estimated income is and what your income is right now. So the price you pay, if any, would be very fair and it would be based off your income right now. So they should always be applying. But you have 60 days, that's your window.
Okay. All right. And so talking to Paris again, thank you so much for taking time from the Healthcare Access Maryland. Again, how can people apply and how easy is it if someone is just tuning in?
So applying is very easy. And if you ever get hung up, again, there is experts like me who are happy to assist you with doing that application for you. You can apply online at www.marylandhealthconnection.gov. You can download the Enroll MHC app on your phone or mobile device, or you can contact a navigator like myself at Healthcare Access Maryland at 410-500-4710.
Okay. And this is a COVID-19 special enrollment?
We do have a COVID-19 special enrollment going on right now. So because of the state of emergency, Maryland Health Connection opened a COVID-19 special enrollment. What this would do is this would allow Marylanders to apply and enroll for insurance right now. So open enrollment is going to give you a plan for next year for 2021, but the COVID-19 special enrollment is going to give you insurance right now. So everybody right now can get covered in insurance. You just have to apply, and we're happy to assist you with selecting your plan for this year and next year.
Okay. Another question for Paris. Do you have family plans that are different from individual plans? Because
Yes.
you know, the individual plans, well, the family plans could be very expensive. Can you explain that to us?
Yes. So we do have different plans for individuals and families. And what that means is an individual can be covered one way, and then a family can be covered under one family umbrella. The plans should be commensurate with your income. So we really work well to find out which plans work for you. And again, 9 out of 10 people get financial help. And for me, that's a good statistic.
Yeah.
So some people do think that insurance is intimidating and expensive, but we really want you to know, come and try us. Let's see what we can do for your family. And the navigators can explain what's inside the plan for you. So we'll explain those deductibles and those co-pays and what those things look like for your family so we can help you out.
Okay. And does this have anything to do with CHIP?
Good. Yeah. So Maryland Medicaid so MCHIP is a children's Medicaid program.
Okay.
Our system is equipped to assist consumers with applying for that as well.
Okay. So how does this differ from private insurance providers?
Okay, so private insurance providers, if you buy your insurance directly from a private insurance provider, you don't get the opportunity to take advantage of cost savings reductions. So the Maryland Health Connection is where you can go to receive cost savings reductions in your plan, which are tax credit or cost sharing reductions. You can only get those if you purchase your health insurance through Maryland Health Connection. If you buy your coverage directly from a carrier, that's okay too. You just don't get to take advantage of that cost savings.
Okay, and your number again?
Sure. Our phone number again is 410-500-4710.
Okay, and where could people enroll again? How can they get that information?
Sure. So people can enroll online at www.marylandhealthconnection.gov. You can download the Enroll MHC app for your mobile device or tablet, or you can give us a call and we'll help you out over the phone or through a virtual meeting.
Okay, and again, we're talking to Paris Bonds, community liaison for Healthcare Maryland, Health Connection Maryland. And I have another question. Can you tell the income level if you have to be within the, I guess, qualifying numbers that may disqualify you from getting into this plan? What are the numbers? What should they be making a year per year?
That's qualify? Okay, so that's a hard question to answer because the amount that they should make per year is also contingent upon their household size. So if you go to marylandhealthconnection.gov and type in the search bar income, an income chart will come up to let you know how many individuals or what the income needs to be for your household.
Okay. Let me see. I think I have a couple questions for you. Okay. Have one from Miss King. How do you know if your plan has expired?
So you would know if your plan is expired. So if it's Medicaid, the plan usually lasts for a year, but because of the COVID-19 pandemic, we have extended the plans out. So you can always reach out to us or the Maryland Health Connection and we can tell you for sure. And I think that's the best method, to just reach out to someone so we can tell you for sure.
Okay. Is there anything else that we should know concerning these plans? I mean, you said that they cover mental health, a little bit of dental, and the entire, I guess, COVID-19 screening and testing. It covers that. What about hospitalization if you're hospitalized for COVID-19 under this plan?
So all plans cover non-essential health benefits. So you're going to get to go to the doctors, you're going to have ambulatory services, maternity care, inpatient hospitalization, outpatient hospitalization. Those services are going to be covered for you. So these plans are no different than anything that you may have had from your employers in the past. These plans are still good. These plans are still really rich in healthcare, and these plans are still going to take care of the needs that you have.
Okay, I have a really good question. If someone wanted to present this to their church members at church service, how could this be done?
This could be done by reaching out to Healthcare Access Maryland. So give us a call at 410-500-4710, and our call center will direct you to the correct person for your inquiry. Thank you so much for being willing to do that.
Okay, and have another one. Dana Smith, she says, does the insurance take effect right away when you apply?
So if you're applying for next year's plan starting in 2021 with open enrollment, those plans are going to start for you on January 1st. If you are applying for coverage today and you're approved for Medicaid, or if you are selecting a plan through the COVID-19 special enrollment, the plans do take effect today. However, if you have to purchase the plan, you have to make sure that you pay your binder payment for the plan to start.
So that's a down payment?
Not a down payment, but just your monthly premium. So whatever your monthly premium is, you have to make sure you pay it so the plan can start. If you get selected for a qualified health plan, but if it's Medicaid, you can expect the plan to begin on the first of the month you apply.
So your monthly payment is used as, I guess, I don't want to say down payment because that's not the word you use. But
yeah, I'm going to say down payment. Down payment is like a one-time payment.
Okay, you said one-time payment?
No, down payment makes it seem like it's a one-time payment. So you don't want to classify it as that. But whatever your payment is per month is what you're going to consistently pay until the end of the plan year, unless your situation changes. And then we would look at the application and go back and reevaluate. So I don't want to say it's a down payment; it's a monthly premium.
Okay, so whatever your monthly premium is, let's say if I was starting today, my monthly premium was $169, I would have to pay $169 today.
You want to pay it today so your plan can start. That's right.
Wow. Okay. Very pertinent information. Paris Bonds from Healthcare Access Maryland. She's the community liaison. Anything else you want to add?
We just want to remind Marylanders that it's just so important to make sure you enroll in insurance for your own peace of mind. You never know what can happen. You don't want to be caught in a situation where you don't feel well and you don't have an option of where to go. So just please reach out to us and apply. Let us walk you through the application process. Take a look and see what type of plan you're entitled to, and let us really give you a personalized experience with choosing your health care.
And again, enrollment is from now until when?
So Maryland Health Connection enrollment for the Affordable Care Act is from now until December 15th.
Okay. All right. Paris Bonds. If you need more information, please log on to marylandhealthconnection.gov. And that number is 410-500-4710. Paris, we thank you so much for
having us.
All this pertinent information, because you know a lot of people are dealing with a lot of different things, health-wise, especially during this COVID-19, and so you have really helped us out today. And thank you again.
Thank you for having us.
Yep, and enjoy this beautiful day.
I will. You too.
Yep. All right.